Okay, welcome back into Patient No Longer. And on this season, we've got some common threads that are flowing throughout, including strategy. So I'm excited to have our next guest on. I've got Morgan Jones, the Chief Strategy Officer of Duke University Health System. Morgan, hello.
Hello, Ryan.
Well, it's good to see you. We go way back. We've done some presentations together and we'll continue to do it. But you are Chief Strategy Officer of Duke Health, a $6 billion preeminent healthcare system based out of North Carolina. You're responsible, Morgan, for leading clinical enterprise strategic planning, strategic intelligence, project management, business development, and consumer insights. Wearer of many hats, you serve as the Academic Chief Strategy Officer and Forum, the Vice Chair on the Southeast Society for Healthcare Strategy and Market Development, and the boards of the Carol Emmett Foundation and Duke's Medicare Advantage insurance product. You do a lot of things. I think that's the first thing that we've established. You also have undergone a promotion. Can you tell me a little bit about that?
Sure. So really thrilled and honored to accept the new promotion of Chief Strategy Officer. So I came to Duke in 2013 and I really increased to be able to help Duke grow. And I think recently was rewarded and recognized for my contribution to that. But again, it's really my honor to be able to serve in that capacity for the organization.
Well, congratulations on the milestone. Always like to call that out. So you're a very newly minted Chief Strategy Officer, and I love strategic planning. We've talked about this before, and I want to before we wade in too far, I just want to get your feeling on the state of strategic planning in healthcare, just broadly in 2025, and then maybe specifically when you think about healthcare organizations. Which part of the organization could really maybe benefit the most from strategic planning that doesn't always get it? What's your take on that?
Sure. So a couple of things. I think when people think about strategic planning, they have multiple different definitions in mind. So when I think about strategic planning, I really think about it from kind of the highest level about why does an organization exist and what are they focused on for the future? I do think probably since COVID, there's been more of a focus about the importance of operations and strategy working together. So you can bring in a consultant, you can develop a strategic plan, and it is a phenomenal paperweight. So it's really what do you do that really gets people engaged and excited about doing something different, either for the organization or for the community. Healthcare is a great place to do strategy because it's typically about improving the health and well-being of a community or a population. And again, when I think about it, it's really about what is it we can do on a day-to-day basis that helps move the organization in the right direction.
Such a great, realistic definition of something that I think unnecessarily gets shrouded in mystery. The other thing is, at the very beginning of your answer, why we exist. And I want to dig in on that because I think sometimes organizations try to answer the why with a mission. And we come out with a mission statement and it sounds good. And maybe it's up on the wall somewhere on the website. A few years go by, we think, well, we need to refresh that. So let's go back in and work on our mission. It's almost like the why we exist gets trapped within the mission. And in fact, you're talking about it from the perspective of strategic planning. Someone listening who says, yeah, I want to bring our mission to life more. We don't talk about it enough. It sits over there. How could they better integrate the mission itself into their strategy or strategic planning work?
Sure. So what we've done is we've established an evergreen strategic planning process. Again, something that we do on a monthly basis, on a quarterly basis, and we tie it in with our operational scorecards such that everybody knows what they're doing, again, on a day-to-day basis and how it supports the overall direction of the organization. I do think that's really important. And again, issues that historically, again, were very operational, like finance or HR, staffing, those things are very strategic. So when you think about who are the people, what's the powerhouse of an organization? It's your people. Okay, so for Duke, we're really focused on people, access, and growth. Those are the three main things that we're focused on right now. So it's our people. We want to make sure that our communities and the populations that we serve have access to highest quality of care that we believe Duke delivers. We also live in our home to the second fastest growing area in the country. So we have to make sure that we're constantly aware of the growth of the population and really how patients are consumers first. People don't want to be patients in healthcare, right? They want to be consumers of healthcare such that they're not sick. They're not having to come into the halls and walls of an organization when they're sick. They want to stay out of the halls and walls of a healthcare organization. So how do we meet them in the community? How do we support their needs and really show up for them? So that's kind of how we think about it. But again, that means when we're doing our operational measures and when we're doing scorecards and even when we're doing compensation for our leaders throughout the organization, it's tied to day-to-day or monthly tactics that everybody can be doing to support those strategic goals. And I do think that's really important and critical. Again, not something that sits on a shelf, not something that you only update every 3 to 5 years, but is something that is in your operational work plans, is in your operational meetings. Strategy has a place there.
Strategy does have a place there, and that was so well said. There's so many things there that you talked about and about Duke that I want to access even more. So I think it's so interesting when we talk about it sitting on the shelf, because that's exactly what it does. And I've been in strategic planning meetings with boards of directors, very sharp people who say, what was our last strategic plan? I mean, it's now been 5 years. It's been so long that different board members, different leaders, and it's almost like it's so easy to repeat yourself in that process. Whereas the evergreen approach keeps it as this living, breathing thing as you go. You can make adjustments as you go. I love the people access growth. The people part, I completely agree with you. That is our best resource. It's the power, as you say. I don't think the people always realize that. I think employees of healthcare have been through a lot, especially through COVID and the Great Resignation, whether you left or your best friend at work left. I don't know that the people always see them as strategic. If you were to give advice to a leader within a healthcare organization, you can think outside of Duke, how do they better make the people feel like they're part of strategy? Because I love what you've done there. And I don't think they always think that way. Is there a way that leadership can bring people up and let them know how powerful they are?
So to me, part of it is just the words that we use. It doesn't matter if it's strategy or if it's operations. It's how do we make everybody feel seen, heard, valued? And as long as they feel seen, heard, and valued, and specifically that the work that they do is supporting the organization, people typically come to healthcare because they care about other people.
Right.
And so again, they then just want to know what they're doing makes a difference, and that if they have something to say, that their voice is heard. So again, it doesn't matter if we say that's strategy or that's it doesn't matter. It's here's what we're trying to achieve. We hear you, we see you, we value you, and you have a place in this organization to help this organization get there.
That's so well said. And I've even seen, in research, and the R in NRC Health is research. And so it's very important to us how the research is positioned, how it's shared with people internally, even bringing people in. I mean, some of our research tools, we've had really progressive leaders almost use their own employees as an audience like they would consumers or they would patients. So just involving them in that way, I think is such a simple yet really effective approach to get them to know you're part of the strategy. I want to stay on data because you've made this point a couple times about the intersection between strategic planning and operations and how COVID really brought that tighter together. What happens in an organization when those things are not coming together? And when strategic planning, whether it's on the shelf or it's just operating on its own island, and ops is over here saying, hey, this is ops, it's ours. If it's not, it's yours. When there's that sort of curtain between, what is the effect then on the organization when those stay separate?
I think there's a lot of turmoil. There's not clarity in priorities. There's not clarity in how decisions are made, where decisions are made. And ultimately, I think it results in turnover. I think you can see it in culture scores. I think you can see it in retention rates. I think you can see it in your bottom line. Your patients are going to feel it too.
I love that you say that about patients. So I always try to recenter this, which I don't even have to with you, but what is the effect on patients? Because we can talk for days about, this amazing pillar, or this amazing approach, or this initiative, or the brand. I get swept up in brand. And I'll have people ask me, what does that do for the patient? Because patients are coming in, and the name of this podcast is Patient No Longer. I mean, they're coming in saying, I want more from healthcare. I have high expectations. I want to have a great experience, especially if I'm waiting a long time these days. When you see really good strategic planning happening, whether it's where you are now or just in healthcare, when it's great, how does that affect the patient and what they see?
So oftentimes I think we identify issues or problems and we sometimes put Band-Aids on them. And sometimes it's because we haven't drilled in far enough to understand what the real issue is. So one of the challenges that, again, I think many healthcare organizations have right now is keeping up with the demands of their growth and the changing expectations of consumers. Do we understand what the expectations of consumers are, such that then we know how to address them or how to meet their needs? And if you don't first collect the data or ask the consumers, we're assuming, and typically we're assuming based upon our own experiences that are often very biased ourselves. So again, ask the question, ask another question, such that you feel like that, again, we understand what the real issue is before we really start solutioning and then developing plans and action items to achieve that solution.
And make sure what we come up with is actually rooted in why we're all here, the patient. We're veering into a favorite topic of discussion for me and something that's been discussed on the podcast before, but this idea of our patients first. And I think maybe 10, 15 years ago in our industry, we would always say patients are first. And I personally don't think people were thinking about it from the consumer lens that you just described. I think we were thinking about people in gowns who were within our four walls, who we could control to some degree. That's changed a little bit. I think COVID has shaken us out of that mindset. And actually, a guy named Brandon Jones from Carillion Clinic I had on the podcast 2 years ago. And we got into a vigorous debate about, is it patients first? Is it employees first? Is there an interchange between the two? Or do you start thinking about things well before they're patients? What is a patient? I'm curious for you, when you hear patients first, is that something that makes sense to you and that you ascribe to, or do you have a different take on it?
I do resonate with patients first, in part because I think at some point in our lives, we are all patients.
Right.
And so I do think, I think we are a lot more than patients. You know, we're people ultimately. Mm-hmm. But the experience that I have at Chick-fil-A or Starbucks or in car line picking up my kids, I expect something very different than when I have an interaction with my doctor or I go to pick up a prescription. And so for me, my expectations in a healthcare setting or health and well-being are very different than walking through the grocery store as an example. And so I do think it's important that we understand who our patients or consumers are, but specifically how do they want to interact in their health.
And what we learn from other industries, I completely agree that those expectations are different. And yet there's things from other industries we can learn. And going back to the example of Chick-fil-A, one of the most interesting things I heard, this was shared at a hub event, our annual meeting. The speaker was talking about how they were looking at Chick-fil-A as the model for drive-through testing for COVID. Because in that scenario, you get in, you get out, and you have your results, whether that is a delicious bag of food or it's a result on a COVID test. We can learn from that. And yet, that's one thing. That's one part. If I go in to see my doctor who I've waited 6 months or more to see, my expectations have completely changed. So I agree with you on that. I want to dig into consumerism and brand too, but I always like to take a little break and do a speed round. You don't know these questions. They're very low intensity. Right. Okay. I ask everybody these questions and there's no right or wrong answers, just your preference.
Okay.
But I do have 5 quick questions for you as part of the speed round. Are you ready?
I'm ready. Okay. Let's go.
Coke or Pepsi?
Coke.
No hesitation there. Fiction or nonfiction?
Nonfiction.
Okay. Is it both?
I like both. Okay.
Don't discriminate one or the other. Morning person or night owl?
Night owl.
Same. Favorite television show or favorite movie of all time?
Ooh, I don't really watch TV. I would say Green Mile is probably one of my favorite movies.
Yeah. Sad, but good. Yes. That's okay. People get stumped on that one, Morgan. It's really really throws them for a loop, at least on this season. East Coast or West Coast?
I'm East Coast.
Okay. You did great.
I am in North Carolina, so you know.
Yes. You sailed through that too. So very well done. Let's talk about branding. I think of you. I think of Duke. It's a brand that everybody knows. Everybody knows the university. You're part of this prominent academic medical center. Is there a power of brand in that? And I'll sort of context the question because you hear that brand is still really powerful. You hear sometimes brand is not as powerful as it used to be. Convenience matters. I'm really curious with the halo of Duke surrounding you. how you feel about the power of brand in healthcare in 2025.
I think brand is incredibly important. But again, it's kind of what brings people interested in perhaps Duke. Where we have to show up and where we kind of make or break is the experience, right? And the experience definitely includes things like convenience. How quickly can you get in? Where do you park? Do you know where to go for your clinic? Is it clear about the expectations of what your schedule is going to look like or what your treatment plan is going to look like? That's all important. And I think that's where, again, brand is, it's the front door, but it's not what ultimately matters. I do think oftentimes what brings people to Duke is the knowledge that, again, it is kind of the best and the brightest working together. And that's true. So it's not Duke as a name, but what is Duke? Why do people come to Duke? Why do people want to work at Duke? And it's because Duke does things that no other organization is going to, right? Duke cares for patients that others would turn away. Duke takes the second opinion in cancer care and says, we'll treat you. We got you. And that is where brand matters. But again, it's not the name itself. It's how it shows up in the delivery of the care.
So that makes so much sense with Duke, with the brand, the power that it has, and that ability to provide deep care. I want to introduce something else that's kind of come into the mix with the brand question, and that's convenience. And I've had people say, well, really, it's just about convenience. Or it's convenience is important and brand is important, but convenience trumps it. If I can get in tomorrow versus waiting for a more powerful reputation or brand to go see in a month or 2 or 3, I'll get in tomorrow. I'm not saying that that's true. But I'm really curious from where you sit, your feeling on this sort of drive to provide convenience over everything else.
Yeah. So again, I think it's both, right? So if my kid has an ear infection, I want them seen today and tomorrow. Nobody wants a screaming kid at home, right?
Exactly.
And as long as they get, the right medication, I'm going to be happy. If I have to wait a week, a month, nobody's going to be happy with that. If my kid has a brain tumor, I want them to see the best.
Yeah.
And I want them to see the best as soon as possible, but I want them to see the best. And so again, that's where I think it's a little bit more nuanced. So are we talking about primary care? Are we talking about services that perhaps I could self-refer into? Or are we talking about true life-altering, life-saving care?
It's really important to think about from that perspective. And I think it's something that marketing struggles with, to be honest with you. The chief marketing officers that I talk to, it's, where do we support and how do we fit that consumer, not only their expectations, which we cover are different, but also their needs at the time, whether it's a high acuity, low acuity, or something in between. You and I have talked about the connection between marketing and strategic planning. We're going to talk about it again at ACHE, shameless plug for our upcoming presentation. Please join us at the annual meeting there. But talk to me about the connection between marketing and strategic planning. And I will tee this up as, I don't always see those two connected. They seem naturally a fit to work together. You're coming up and generating the strategy through a deep planning mission. Everything is included. And I go out and I promote, and blast it out there, and we have a feedback loop. But it doesn't seem like it always comes about. So for the marketers listening or the strategic folks listening, how do they better integrate and work with their counterparts?
Yeah, and I think this is an area that's constantly evolving as well. So again, I think it goes back to, do organizations understand their story? And in order to understand their story, you got to be able to be really honest with yourselves. This is what we do well. This is where we struggle. This is what we stand for. This is what we want to achieve. And in order to, again, understand that and be able to improve it or move forward, you have to be able to communicate it in a way that others can get behind it, right? You want a workforce, Duke, we have almost 30,000 employees. We want people to understand what it is we're trying to do and how they can support it. And that's where there's the internal communications piece and the external marketing piece. So as we're growing, as an example, we want people to know this is who we're trying to recruit for. These are the services that are really important in our community. In our community, hey, we're coming. We're going to be opening this new clinic. This is what you can expect. This is when we're going to be open. This is how you can connect with your provider or develop a care team there. I think all that's really important, because otherwise what happens is you see a box go up with a Duke logo.
Sure.
Well, what's there? When are you open?
What's
Who's in
behind that?
network? Who are the doctors there? How do I get in? And that's where, again, if you don't have a solid marketing plan, because you also want the community to be excited about it, right? You want the community to be excited and preparing to receive their services, particularly for somewhere like our area where we do have a lot of local providers with a lot of options.
Sure.
And so we want people to know Duke's in the community and we're here to provide excellent care in a convenient and accessible way for you.
I mean, you strike such a nice balance there between sort of macro and micro, and between the brand sort of draws me in, but then there's the details of that. And there's the ability within the planning process to know where I'm going to go and move through the system and have a great experience. I also really like that you brought up courage and honesty. This idea that, I think sometimes we're afraid of, being too transparent or doing something that seems risky. For some reason in healthcare, we all think of ourselves in a way almost as a clinician where variation is bad and we want safety, quality, all of these things. When you say be honest, I think that that's so important and such a nice reflection that people should have. I also think that that's the important part of innovation. So I'll throw out innovation as well, because that's another topic this season on the podcast, is this idea of how do we innovate going into 2025, knowing that there's been a lot of attempts to innovate and change certain healthcare models with mixed success. How important is innovation to you in this world of strategy and strategic planning and marketing and brand that you sit?
I think innovation is really important. I think it goes back to the words and the terminology. I think sometimes in healthcare, people struggle with the words innovation. Sometimes people in healthcare struggle with the words research. And so if you talk about it instead as improving quality of care, we are brainstorming, we are collectively solutioning. That is innovation, that is research, and we're doing it to what end? We're doing it to improve the experience, to improve the outcomes, to improve whatever we determine the problem to be.
Your explanation on research, I'd like to borrow you and take you with to some other clients of NRC, the research part. It doesn't always lock in like that. But back to Duke, because I go back to the beginning talking about people, access, growth. And as our time draws to nigh, I want to ask you about growth. Specifically, growing in healthcare right now, always a challenge, really a challenge in 2025. I also want to ask this with the caveat of those other disruptors that are trying to grow themselves into our business. So you've got your CVSs, your Walmarts, your Amazon, some of which have taken a step back. Amazon's still around with One Medical though. Do you see your growth path involving overcoming some of those competitors, partnering with some of them, focusing strictly on the patient population? What is in your mind the path to growth over the next few years?
Yeah, such a broad question. I can go a lot of different directions. I would say, again, when we think about growth, we really think about meeting the demands of our growing patient population. Given how quickly our area is growing in population, again, we're home to second fastest growing area in the entire country, right? So I think that healthcare is such a large issue and need that if one organization can do it by themselves, I can't wait to see it. Right?
Show us your business plan.
Right. I can't wait to see it. And so again, I think there is space for everyone. And actually, we're going to do better by working together and learning from each other. I still think, again, CVS, you know what you're good at. Aetna, you know what you're good at. One Medical, Amazon, et cetera, Duke, you know what you're good at and what you're not. So how do we complement each other to, again, really deliver exceptional quality and care to our consumers? Because what Duke offers is very different than what One Medical offers, of which we are a One Medical partner, which again is very different than what a CVS offers. So that's how I think about it. And again, understanding the problem, understanding where we are each uniquely positioned to deliver expertise and how do you come together, I think is really what's going to ultimately innovate the industry and be transformative for healthcare.
Yeah, and that was a really pragmatic answer in pulling a lot of those things together. And I also think who would agree with you is the average consumer who says, listen, I want options, but I also want you guys to cooperate more than you compete. I want you guys to work together because I might traverse several of those points in a single healthcare journey. I want them to be tied together. And I love your idea of there's room for all along that journey. I will end with a very specific question that I ask everyone. So you're no different, Morgan. And you've been with this organization for a while, but let's say you get in an elevator in Duke somewhere on the campus, and someone walks in right behind you and shares on this short elevator ride that it is their first day in healthcare, what is a piece of advice you would give that person on day one?
So I'll tell you what I do tell people.
Sure.
I do tell people, hey, I've been at Duke since 2013. There's some days I feel like I've been here 50 years and some days I feel like I've been here 5 minutes. I learn something new every single day, but as long as I continue to focus on the patient, I believe I'm constantly improving for our industry and our organization.
Incredibly well said. They would all benefit from an elevator ride with you. The 50 years or 5 minutes, I think we all in some way feel that. That is just so well said and on point. Morgan, I want to thank you so much for partnering up with me again and for being a part of the Patient No Longer podcast. We really appreciate the conversation with you.
Well, thank you so much.
All right. Thank you, everyone.